let us learn how to interpret knee valgus compensation during the overhead squat assessment, its clinical reasoning and sample corrective exercise. When it comes to exercises, there are plenty of them. Here I will just give a basic idea to guide you through it. It is very direct and a basic understanding that whenever the knee moves in for valgus, the therapist will think automatically that the adductor is going for overactivity and the gluteal component is being weak or underactive. But there are a lot of other muscle groups to be focused on. So let's discuss them and understand the reasons behind it. Firstly, let us understand what are the faulty or the compensatory movements happening at the hip and the knee joint when the knee collapses into the knee valgus. Movement at the hip joint, that is the compensatory movement, is the hip internal rotation, and at the thigh it is the adduction. The faulty or the compensatory movement happening at the knee joint is the tibial external rotation. Sometimes it is also, you will also see ankle pronation, but not in all cases. In this video, let us understand these three components. This is the solution table for knee valgus compensatory movement during OHA, that is the overhead squat assessment. So the overactive muscles are your tibial external rotators, femoral internal rotators, and your adductors. And the underactive muscles are the antagonist of your overactive muscles, which are your tibial internal rotators, femoral external rotators, and the abductors. Apart from that, the vastus lateralis goes for overactivity and the vastus medialis goes for underactivity. Let us understand how vastus lateralis and medialis get affected during the valgus movement. So there is a concept at the knee joint called as the bowstring effect. So what happens here is whenever the structures at the lateral aspect of the knee are tight, it pushes the patella in. Okay. When the patella moves in or medially, the vastus lateralis acts excessively to pull the patella back to its normal alignment, or it pulls the patella medially, leading to inactivity or underactivity of the vastus medialis. So this is how the vastus lateralis and medialis get affected. Remember, vastus lateralis and medialis are not responsible for causing knee valgus, but due to the knee valgus, these muscles get affected. Okay, so let us revise it again. The compensatory movement happening at the hip joint is the hip internal rotation. At the thigh, it is the adduction. And at the knee joint, it is the tibial external rotation. Now, the corrective exercise strategies for overhead squat assessment when the knee goes for valgus. So firstly, you should always release and lengthen the overactive muscle. So these overactive muscles will go for shortening, but remember these overactive muscles are not necessarily be strong always. Okay, so here the release and lengthening should be carried out for the adductor complex, hip internal rotators, tibial external rotators, vastus lateralis, and the plantar flexors. So the plantar flexors has to be released only if there is a restricted ankle mobility, or else you can just stick on with these four components. So in this video, I will show you the basic releasing techniques for the adductor complex and the hip internal rotators. In my previous video, I have showed you how to release for the tibial external rotators and the plantar flexors. So to release the TFL and the glutes and your adductors, you can do it with your foam roller. So you can use your foam roller to release the ITP, the glutes, and the adductors. And then you can stretch your adductors to the butterfly stretch. And here you can see this is how you stretch your glutes as well as your TFL. Next, you need to carry out the activation exercises and the strengthening exercises for gluteus maximus, medius, tibial internal rotators, VMO, and the tibialis anterior and posterior. So tibialis anterior and posterior activation should be carried out only when there is a restricted ankle mobility, or else you can just stick on to activating these four components. So in the previous video, you can see how to activate the tibial internal rotators. Here I will be focusing only on these three components. So to activate the gluteus maximus, the hip should go for abduction and extension. So whenever the hip is going for abduction and extension, it causes activation of the gluteus maximus, and it reduces the activity of the tensor fascia lata and the biceps femoris. So how do we activate the glutes? Firstly is by doing this bridging exercises. Next is you can do hip extension and abduction in the standing position along with a resistance band. Initially, you can start without a resistance band, then gradually you can progress with a resistance band. Then you can lie down prone and do the hip extension and abduction along with the resistance band. So you can see, these are just three simple exercises. There are a lot of variations to it and a lot of exercises. So these are just a sample exercises. So I will make a separate video, like, how to progress with the glutes maximus activation. So moving on to the gluteus medius activation. To activate the gluteus medius, I have listed out five simple exercises. First one is your clamps, wherein the ankles are fixed together, only the knee moves apart. This is the resisted clamps with the TheraBand, and this is side lying leg raise. This is a side lying leg raise with a TheraBand, and this is lateral walk with the band. Moving on, you can do this lateral band walk along with the squat position. This is an integrated glute activation exercise. It mainly helps to activate the gluteus medius muscle. Next, you can start activating your VMOs, that is the vastus medialis oblique. So there are a lot of ways how you can activate it. Here I have listed three simple ways how you could activate. The first is terminal knee extension. So for this, you can just place a bolster under the knee and ask the patient to lift the feet off the ground or the couch. Next is the terminal knee extension in the standing positions, and this is done through a TheraBand. So here this exercise is called as a straight leg raise with the feet externally rotated. So here you ask the patient to externally rotate the feet and raise the leg off the ground along with a slight or minimal knee flexion. And this is a static lunge with resisted terminal extension. So here you ask the position to go for a static lunge and then come back to a neutral position. So when the patient is coming back to the neutral position, the resistance is provided with the TheraBand. So these are just basic corrective exercises strategies which will help to reduce the knee valgus during the overhead squat assessment. And remember, it is not always wrong to have a mild amount of knee valgus. It is okay to have a small degree of knee valgus. Okay, you need to correct it only when the patient is complaining of pain, or when you think the patient is at a high risk of developing any injury. Thank you.